Good morning and welcome to the first of our Friday briefings with Dr. Farley. These briefings are intended to provide press with an additional opportunity to get the latest updates on the city's COVID-19 response. Dr. Farley will be hosting these briefings every Friday for the foreseeable future. We're working to secure additional guests to help provide insight into the response on the ground. Today, we are joined by Dr. Scott McNeil of the Delaware Valley Community Health, a federally qualified health center that provides care to traditionally underserved communities and has been administering COVID vaccine to their patients and staff for several weeks. Dr. Farley will first provide an update on the city's response, and then Dr. McNeil will talk about DVCH's role in the response. We'll then open the floor to questions from the press. Dr. Farley, can you kick us off?
Yes, thank you very much. So thanks for joining. First, I'm just going to give you a brief update on where we are with the vaccine rollout. And then I want to talk a little bit about federally qualified health centers, of which Dr. McNeil runs one of them, and the connection with vaccine hesitancy. And then I'll turn it over to Dr. McNeil. So overall updates on the vaccine rollout, we have now vaccinated 161,000 people with their first doses of the vaccine and 79,000 people with their second dose of the vaccine. And as we're increasing the number of people that we are vaccinating, our demographics of those people vaccinated is gradually becoming more diverse. We know that we're not reflective of the city's population right now, but and we want to have our population vaccinated be more diverse. So the percent African American amongst those vaccinated is now 20%. That's an increase from 8% when we first started looking at this. Now, there's been a lot of interest in the vaccination delivery and uptake by neighborhood and zip code across the city. And so we have done an analysis of that, vaccine doses delivered per capita by zip code. And the low income and predominantly minority zip codes are relatively under-vaccinated compared to other zip codes in the city. In particular, the zip codes in North Philadelphia and the near Northeast are the less vaccinated zip codes. There's a map on that, which is posted on our website, and you can see that. And we'll be updating that map on a, if not daily basis, almost daily basis. Now, we are ramping up the number of doses that all the different providers across the city combined are delivering of the vaccine. So 2 weeks ago, the week before last, those providers delivered vaccine, 35,500 doses of vaccine to people. And then last week, they delivered 47,500 doses, so a substantial increase. We need to have many more substantial increases in the future in order to ultimately get to our goal to vaccinate as many of the adults, 1.2 million adults in the city as possible. That increase is reflecting an increase in vaccine administrations through all the different channels and all the different providers that are offering vaccine right now, including hospitals, clinics, pharmacies, and community-based providers. Now, with those increased vaccination opportunities, we have started and will continue to refer people who have registered on the city's website and our vaccine interest database, referring them to vaccination opportunities. So in the past week, we have referred everyone in that database who was over the age of 75, that's some 29,000 people, to opportunities to be vaccinated at the city's pharmacies, with the biggest pharmacy participating in this at this point being Rite Aid. We have also used that database to direct unaffiliated healthcare workers to mass clinics that we are running at the convention center today and tomorrow, and people under the age of 75 who meet medical eligibility criteria to other opportunities that is run by the city and other providers. Now let me talk a little bit about this issue of vaccine hesitancy and federally qualified health centers. We know we need to make the vaccine available to more people, but we know that many people right now are very eager to get this vaccine. That's a good thing. But at the same time, there are many, many other people who are very hesitant to receive the vaccine. They have concerns about the safety of the vaccine. And there's been research on why people are concerned about the vaccine and who is someone that they might trust to recommend that they get the vaccine. The national survey of 1,000 adults on who are their most trusted messengers gave results that might be a little bit surprising to some people. It found that the people who people trusted most to give them advice on vaccines were their own doctors and own nurses that they already knew. It was not celebrities. It was not the local government or other people in the community. It was that person's own doctor, nurses, the ones that they're familiar with them. And that ties in then to federally qualified health centers. For those of you who don't know, these are health centers that serve predominantly low-income residents of Philadelphia. They provide a full range of primary care services at no cost to the patient. Many of them serve new immigrants and non-English speaking residents of Philadelphia. And they're a very key part of the medical care system here in the city. A number of these organizations have multiple clinic sites. There's one organization with multiple sites. Currently, there are 12 organizations, 12 providers that are offering vaccination at some 30 sites across the city. Last week, collectively, they delivered over 5,000 doses, and the number is increasing. The one key advantage here is that these patients, these organizations are inviting in their own patients. These patients have built up trust with their doctors and nurses over years. And so they're now listening to the people that they trust most to give them advice around the vaccine. So they're more likely to accept the vaccine. So we are supporting these federally qualified health centers as a key part of our racial equity strategy. Currently, we're providing vaccine. And in the future, the Centers for Disease Control will be providing vaccine directly to federally qualified health centers. Now, of the federally qualified health centers in the city, the one called Delaware Valley Community Health is administering the most vaccines in the last week or so. And so that brings me to introduce the next person on this press conference, Dr. Scott McNeil, who is the president and chief executive officer of Delaware Valley Community Health. And he also serves on the city's Board of Health, so someone I've been in contact with frequently for a long time. So with that, I'll turn it over to Dr. McNeil and thank him for joining us today.
Thank you, Dr. Farley. I appreciate that and appreciate the opportunity to talk about what Delaware Valley Community Health has been doing for the residents of Philadelphia for many years, but in particularly in terms of the COVID response. So our organization actually has been providing linguistically and culturally appropriate care to Philadelphians for over 50 years. And during that time, we've grown to 8 sites. We have approximately 330 employees, and we're taking care of approximately 42,000 Philadelphia patients every year. So again, as Dr. Farley pointed out, FQHCs or federally qualified health centers, whether it's in the city of Philadelphia or across the state or across the country, are well known to be providing this kind of care. Again, what we call multicultural and linguistically appropriate care that has a variety of primary care modalities. So we are providing pediatric care, adult care, family medicine, obstetrics, gynecology, women's health care. We provide behavioral health services, dental services, eye, vision, podiatry services. Now, for my organization, we don't provide all of these services at every single site, but we provide them at many of our larger sites. We also have legal assistance at certain sites. We have a medication-assisted treatment for substance use disorder at some of our sites to address the opioid issue in the city. So we've always been responsive. And when I say we collectively have always been responsive to the public needs of this country. And I think that most public health officials and most elected officials certainly are aware of what we contribute. So for my organization, we're not necessarily known as Delaware Valley Community Health. To our patients and to our community, we're much better known by our individual health center name. Our largest health center is Maria de los Santos. It's between 4th and 5th Street on Allegheny in the heart of the Latino community. We also have Fairmount Health Center at 14th and Fairmount, Norristown Regional Health Center out in Montgomery County in the heart of Norristown, Parkview Health Center, which is in G and Hunting Park for women's health services. And then we also have 4 smaller satellite sites, another women's health care facility, also in Allegheny Avenue. And we have behavioral medicine partners or behavioral health partners where we provide primary care services to their dedicated behavioral services for those that are suffering from chronic behavioral needs. So we have a satellite with Horizon House in West Philadelphia, a satellite with Marikey and their Sharon Hill location, and a satellite with behavioral wellness at Girard at 8th and Girard. So just a quick snapshot of kind of what Delaware Valley Community Health has been doing and continues to do around all chronic disease management. We are aligned locally, as Dr. Farley pointed out, with several other city FQHCs, and we are aligned under the Health Federation of Philadelphia. We have a statewide coalition called the Pennsylvania Association of Community Health Centers, or PAC, and we have a national consortium of health centers, which is the National Association of Community Health Centers. So we are located in every state in U.S. territory, so including Puerto Rico and Guam, There are some 1,300 health center organizations across the entire country. And as Dr. Farley pointed out, many of them have multiple locations. So we truly are the safety net of healthcare in this country. So it is not unusual for us to be having to respond and continue to meet the needs of low-income or underserved communities, particularly communities of color. So although we are a private nonprofit and we answer to the federal government, we also work strategically with state and local health departments. So as Dr. Farley pointed out, being federally subsidized, about 80% of our insurance, 80% of our patients have insurance. For the 20% that do not, most FQHCs receive some variety of a block grant to provide those same level of health care to those patients without their ability to have to pay. We do have a sliding fee structure. We ask people to pay what they can, but if people are not able to pay at all, they will get the same exact treatment that somebody with, commercial insurance would get. That's what happens in FQHCs. Even though some are much smaller than mine, some are bigger than mine, you'll find that pretty much all the way across the country. So in responding to Dr. Farley and the needs of the city of Philadelphia, we've been aligned with things like the opioid epidemic or gun violence or the obesity epidemic. There are a number of things that FQHCs help to respond to because we are already in the communities that are most at risk. When it comes to the COVID situation, we began doing testing of COVID back in early May. We tested probably over 6,000 residents or our patients at this point. Of that 6,000, probably 70% of those people that we tested were patients of color. And as Dr. Farley pointed out, in terms of now vaccinations, we have been vaccinating since early January. And our numbers may not be as large as some others that have been out vaccinating for two reasons. First, we're just doing it recently. And secondly, I just want to point out in the beginning, as I talk about what we're doing with vaccinations, that we're not trying to be a mass vaccination site. We're trying to complement those mass vaccination sites. So it's not a one size fits all. As those that are doing broad vaccinations, we're trying to target those that qualify within the appropriate categories, those patients that are most at risk, as well as community members. For example, under 1A, not only did we vaccinate our own staff, but we are vaccinating those community partners in the same communities that we're working at, what might be pharmacists or other healthcare workers. As the city progressed to 1B and looking at particularly those residents that are 75 years and older, what kind of sets us apart, as Dr. Farley talked about, we already know these residents, and they're less likely to be signing up on a electronic website. They're less likely to perhaps drive or go into a long line of a mass vaccination site. They do need a little more reaching out. So the cross section of my organization that is helping to address this, which are the physicians and providers and nurses and social workers and outreach workers, we are going through our list and calling these patients and trying to educate them, because there is hesitancy, as Dr. Farley talked about, and trying to get them to come in testing. So we're kind of more of a low volume, but a much higher touch in our response to COVID, both vaccine as well as testing. So at this point, we have provided about 1,500 vaccines since January, and approximately 50% of those vaccines we provided so far have gone to communities of color, particularly who have been impacted disproportionately by COVID. So we are able to actually provide more vaccine than this. So we're trying to ramp up as vaccine has been made available. We are vaccinating at 2 of our Philadelphia sites and one at our Norristown site as well, which they receive vaccine directly from the state, but our 2 Philadelphia sites receive vaccine from the city of Philadelphia. We're going to have, hopefully, maybe next week, a 3rd Philadelphia site that will also be vaccinating. I think it's important to point out as well is that many have heard that the Biden administration now has selected 250 of the over 1,300 FQHCs across the country to be able to get direct vaccine. So in addition to the state vaccine that we get at our Montgomery County facility and the city vaccine that we're going to be receiving at our 3 Philadelphia sites, Delaware Valley Community Health is one of 3 Philadelphia FQHCs, up to 250 across the country, that were selected to receive vaccine directly from the federal government. The other two is the Family Practice and Counseling Network, which is located in the East Falls area, and PHMC, Philadelphia Healthcare Management Corporation, that is located in Philadelphia and has several sites. So we're able to meet the need of even more vaccine supply to continue to target. We do have electronic registration. We do allow vaccine for people who are not our patients to sign up if they're category appropriate. But we are giving preference to our communities and our patients by utilizing the techniques that I spoke of. So a quick review of what we've been doing with the COVID response so far, remembering that, again, our organization continues to treat these same community members for all the rest of their chronic care needs with the services that I mentioned prior to that. So it's not as if we have a dedicated just vaccination team that can do this all day, every day, but we continue to try to create that structure so that we can ramp up a little bit and give even more vaccine to the at-risk communities. I'll stop there and perhaps see if there's questions.
Thank you very much, Dr. McNeil and Dr. Farley. We will now move to the Q&A portion of today's agenda for members of the media. Reporters are asked to limit their questions to 2 or fewer. This is due to the shorter amount of time that we've got today. If we run through those questions, we'll do a second round if time permits. We ask the folks, please keep their questions focused on the topic at hand. As a reminder, both Dr. Farley and Dr. McNeil are available for questions. For those logged in today, please use the raise your hand function like you do on Tuesdays. We'll now unmute the reporters one by one to ask their questions. Jeff Cole, I've got you first.
Okay. Let me just quickly get my video up, and here we go. This is for Dr. McNeil. Doctor, how much vaccine are you receiving, and what do you think you can ramp up to?
It's a good question. For our Philadelphia sites, we were receiving initially about 50 to 100 to a week. We're now up to about 500 a week, and we probably could double that. We could probably work around 1,000 a week for our Philadelphia sites, particularly if we get our third vaccination site up and running next week.
And when the feds give you vaccine directly, does that move you to yet another level?
It will, and so therefore we're looking for that infrastructure, and right now we're using, as I mentioned, our existing staff. We may need to be looking for ways to actually fund and receive, either add additional staff or be able to maybe open up on the weekends that it's just dedicated vaccination, and use our employees to do that just on the weekends to meet the need and to work with the extra vaccines that we're going to be receiving.
I have one more question for you. Today, beginning at noon today, the Black Doctors COVID-19 Consortium will begin a walk-up and will go for 24 hours. Speak to what it is Dr. Stanford is doing in that community, and how you think that works in this idea of in this concern about hesitancy.
Well, again, I really feel like the efforts that what they're doing are commendable. I think it's a synergistic relationship. That's why I mentioned that is more of a max vaccination type of model, and it is great for those people that can respond and come out to that. So it's not a one size fits all. There, as I mentioned, though, for what we're doing, there are people that are hesitant who are not going to respond to them, and there's no way that a max vaccination site can reach those people. They're not aware of them, and if they don't respond, then how do we know that they're out there? So that's why I think FQHC's play this vital role, because we know who those patients are, and we're doing the outreach to them. It's much more labor intensive because we have to find them and try to convince them to come in. But the yield of getting to those really at-risk patients is worth it. So it's there. What Black Doctors COVID Consortium is doing is fantastic. Our model is complementary to that.
Great. Maybe I can contact you later on. We'd like to see one of your sites at some point. Thank you very much.
Thank you so much, Jeff. Next up, we're going to move to Dale Mezzacappa from Chalkbeat. Dale, I believe you can unmute yourself now.
Yes, thank you. Dr. Farley, I was wondering if you could give us the latest updates on teacher vaccinations. They're supposed to start on Monday. Can you tell us how many people have been informed, and whether you've chosen whether all 7 sites you're talking about will be up, or how that's going to be working?
Yeah, I can only say that they will start on Monday, that people Teachers and other school staff have invitations have gone out, not to all of them, but they've started going out and they've started scheduling their appointments. I believe that next week, CHOP is going to talk more about the locations of the other sites and more about the process.
So as of now, do you know how many people? You said that there were 10,000 who are supposed to go back most immediately whenever the K-2. Is that number correct? The 10,000, are those the people who've been notified?
The CHOP is starting with the teachers who are at the lower grades. And that includes both those who are potentially going back and those who are in the non-public schools that are already teaching. And then they'll work towards the higher grades later. But I don't have any more details than that.
Okay, so you don't know how many people have actually made appointments but for now, all of them are going to be at the CHOP location.
The first doses will be, first doses to be delivered will be at the Roberts Center within CHOP, but they later will be providing vaccine at other schools around the city. And I believe next week they may talk about what schools those are.
Okay, thank you.
Thank you very much, Dale. Next up, we have Daryl Murphy from WHYY. Daryl, I believe you can ask your question now.
Thank you. I'd like to know, have all 29,000 people referred to pharmacies for a shot? Have they been able to make appointments?
I don't have the answer to that.
Okay. Also, and do you have any advice for those who have been referred but are unable to make an appointment?
Yeah, there will be more opportunities in the future. We wanted to at least give these opportunities. If Rite Aid, I believe, has appointments open for as long as a month. And so I hope that there's still some available when they get it. But if they're not, they're still in our database and we'll give them other opportunities.
Thank you, Dale. You all done? Or Daryl, I'm sorry. Looks like you've gone on mute.
Yes, I just have one more. How is the city reaching seniors with no internet access?
So seniors who want to get into our database can call 311 and then we will put them in our database. And then when we go to our database to invite people, for those people who don't have internet access, we place phone calls to them.
Thank you very much, Daryl. Next, we're going to move to Laura McChrystal from the Inquirer. Laura?
Hi, Dr. Farley, I'm wondering if you could address how are talks going for FEMA potentially opening a vaccination site in the city?
So stay tuned. I don't have anything to announce right now, but I hope that you'll hear something very soon.
Okay. And I'm wondering, has the winter weather this week slowed vaccinations or led to, a higher portion of the doses the city received going unused?
I am concerned that it has slowed vaccination. The number of clinics that couldn't operate yesterday because of the weather. And then as you probably know, there are doses that couldn't be shipped because of the weather. And so some of those doses that were supposed to arrive this week will arrive next week. And I don't know if that may slow down some of the providers if they don't have enough in stock.
Okay, thank you.
Thank you very much, Laura. Next up, we have Laura Make from NBC 10. Lauren, you should be able to unmute now.
Hi, all. Hi, all. Can you hear me okay?
Yep.
Okay, excellent. Dr. Farley, I think FEMA sort of jumped ahead of you. Their press release came out at 11:08 announcing the site in Philadelphia at the convention center that is being planned. So what can you tell us about how that's going to work? And specifically, I know that the administration has not wanted to do a site at the link, but there were certain things about that, like parking and it being outside, that are not the case at the convention center. So how will the logistics of that work?
Much is yet to be worked out, but certainly the convention center is inside. And so with the weather, as you've seen now, we won't have the weather problems we would at an outside facility. We do think that the convention center can handle the large volume we're talking about. A type 1 site is supposed to be 6,000 people per day, which is quite a few people, but it's a very large convention center, and it's got great transportation access, both people driving as well as people taking public transit. So we think it's a great site for this.
Where will the vaccines for that site come from? Since it is partnering with FEMA, will you get additional allocation to use for that site, or do they have to come out of the city's allotment?
Yeah, so the federal government has different sites that they designate type 1 and type 2. This is the type 1 site that the vaccine is going to come with the federal support. So it's not taken out of our local allocation.
Okay, and just one quick thing I wanted to check on. The state over the last 2 days has talked about some issues they've had with a mix-up with Moderna, and then also some delays from weather, which I think you addressed a little bit. Have you seen the same issues at the city level that they saw at the state level with either of those things?
We have not seen that yet. We're looking at this closely, and we're trying to monitor inventories and use, and so far we have not had that problem. We're keeping a close eye on it though.
Okay, thank you.
Thank you very much, Lauren. We have time for one more question. If anyone's got them, please raise your hand. All right. Seeing no more questions coming through, I wanted to thank everyone for joining us this Friday morning. We will see you all on Tuesday at our standing 1 o'clock press briefing, and then we will let you know when the next week's Friday briefing is scheduled. Thank you again for your participation and for covering this topic.